Thank you very much for opportunity to take reports at this very high authoritative congress. Today I would like to present preliminary data of measurement of the blood pressure and some parameters of body mass index and waist circumference. The prevalence of the hypertension is very high, and according recent publication in the Lancet journal, we can see that prevalence of hypertension is remaining high, and according to the Asian countries, we can see that hypertension is highly prevalent in Asian countries, especially in the Central Asian. And this publication is presenting results of the observation during almost 30 years period, and there have been observed high prevalence of the hypertension in most of countries. I would like to focus your attention at the Central Asian countries in the high prevalence of for female part and also for male part of the population. And also we know that cardiovascular risk in urban working population is also rising due to some specific factors, for instance, sedentary work, high prevalence of the stress and lifestyle factors. Urban employers are usually exposed to sedentary work, occupational stress, and understanding the profile of the blood pressure and adiposity measures and muscular strength in diverse urban employers groups enables targeted prevention and early interventions. We aimed to assess the cross-sectional distribution of hypertension, obesity, central obesity in urban employees, and to examine associations with gender and occupation with implications for targeted workplace prevention. We performed measurement of the blood pressure, systolical and diastolical blood pressure. All measurements were conducted using the standardized calibrated protocols. The recent clinical guidelines, European Society of Cardiology published in 2024 in European Heart Journal, principles were used for performing the above mentioned measurement of blood pressure. Except measurement of the blood pressure, we used anthropometrical investigation. We performed measurement of the waist circumference. We measured the height and weight of patients using certified equipment. Also, the hand grip strength was measured with a calibrated dynamometer with the best of multiple trials recorded. Measurement and assessment of the obesity, we used well-known diagnostical criteria for obesity. The cutoff level of the body mass index was 30 kilogram by meter square. For measurement of the assessment of abdominal obesity, we used cutoff levels of the abdominal obesity published in previous years, published in journal Cardiovascular Diabetology. And cutoff level for abdominal obesity for male people was 94 centimeters square and more. For female participants, cutoff level was 88 centimeter waist circumference. The study design is presented at this slide. We performed investigation of 506 participants. Due to some 23 patients, they didn't meet the inclusion criteria, and 18 patients, they couldn't give written informed consent. Finally, 465 patients were enrolled in this study. We use inclusion criteria: age at least 18 years and more, Asian origin, currently employed in urban sectors, banking, law enforcement, or municipal services, and being able to provide written informed consent. Exclusion criteria, we didn't include pregnant female or breastfeeding mothers having acute illness or infections as a time of assessment, presence of severe musculoskeletal or neurological disorders limiting participation in dynamometry or blood pressure measurement, and cognitive impairment or inability to provide informed consent. The study protocol was discussed and approved by the ethical committee of the Akhunbayev Kyrgyz State Medical Academy, and written informed consent was obtained for participants. All data were handled confidentially and analyzed in aggregate. Results: we evaluated assessed patients, and there were 338 male participants and 127 female participants. And average age was relatively young, 35, and female participants were significantly older than male participants. According to the level of hemodynamical parameters, the level of systolic blood pressure was higher in male than females, and diastolic blood pressure was also higher. Body mass index was higher in male participants, and waist circumference also was higher. Hand strength was significantly different according to the gender of participants. Prevalence of hypertension, obesity, and abdominal obesity is presented at this slide. You can see that almost 1/3 of patients, one-third of participants, they have had high blood pressure. Obesity and abdominal obesity were distributed not equally among male and female participants. You can see that male participants, they have had a higher level of the blood pressure, they have had higher level of the body mass index, and the rate of abdominal obesity was higher in male participants than female participants. And correlations of hand grip strength, this parameter has correlated with the most significant correlation was observed in according the waist circumference and the gender. Also, body mass level of the body mass index and systolic blood pressure and age were correlated more significantly with this parameter. So in conclusion, routine blood pressure and adiposity screening across sectors is necessary for urban employers. Targeted programs for weight management and abdominal obesity reduction should be developed. Integration of stress management and physical activity initiatives aligned with job demands in banking, police work, and municipal services. Future investigations should include longitudinal follow-up and evaluation of intervention efficacy, for example, structured exercise, stress management, dietary counseling to reduce cardiovascular risk and improve overall workforce health. Thank you very much. If you would have questions, I would try to answer to your questions.